Hello everyone, and thank you all for joining another Callus Professional webinar. My name is Laura, and today we are really excited to have Dr. Julia Sen with us, consultant ophthalmic, plastic, reconstructive and cosmetic surgeon with over 20 years experience in her field. She is also the director of Midlands Aesthetic Clinic. The presentation will be around 45 minutes long, and then we'll have a 15-minute live Q&A session at the end. If you have any questions during the presentation, please feel free to type them in the Q&A box at the bottom of your screen. And please don't take any pictures or screenshots during the presentation, just due to patient confidentiality. So without further ado, I will pass over to Dr. Julia Sen.
Hello everyone, thank you so much for joining me this morning. As Laura has told you, my background is in ophthalmology. I subsequently specialised in oculoplastic surgery, and so much of the work that I do is skin cancer and reconstructive surgery. And that's really has been what's promoted my interest in wound healing and all of the things that we can do as doctors and practitioners to improve outcomes for our patients. My interest in skin, wound healing and reconstructive surgery has extended latterly into the more aesthetic world, because I think there is a continuum. I want the best aesthetic results from my patients, and I also want to be able to provide my aesthetic patients with the outcomes that they're looking for. So my talk, I will reference some of my experience in ophthalmology, because I think that's very relevant here. I don't know if there are any ophthalmologists in the audience, but there's quite a lot of crossover, so I think you'll see that as we're going along. So I'm now going to attempt to share my screen with you. Here goes. Okay, Laura, are you able to see that? Yeah.
Yes, I can. Okay. Perfect.
Thank you. So I'm just going to move along to the next slide, and then if you can, has that come up?
Yeah, all good.
Great. Okay. So the title of my talk is Optimise Results, Reduce Downtime, Increase Patient Satisfaction. And I think that for those of you who are already using Callusim and Callusim products, you'll already be aware of some of the benefits of this. I'm hoping to introduce you to maybe one or two new applications that can benefit your patients and your practice. To give you a flavour of the sort of work that's my bread and butter, this is an example of the kind of patient that I deal with on a day-to-day basis. So this is a lady who has had a non-melanoma skin cancer, the type removed from her left lower eyelid. Now, in the UK, we have a predominantly Caucasian population, and we have an elderly population. And so those two factors conspire. So we see a huge amount of skin cancer in this country, predominantly non-melanoma and predominantly in older age groups. In those older age groups, when I'm reconstructing a wound like this, I at least have the advantage of a lot of extra skin laxity, and these cases can be less challenging. In younger patients, there is often a more aggressive healing response. There is less laxity. The reconstruction can be more challenging, but ultimately what I want to get for all of my patients is the result that I was able to get for this lady that you'll see on the right hand side. That was taken a year following the procedure, and you can see just about the scars from the flap that I reconstructed her eyelid with. Again, there's an overlap here between the reconstructive and the aesthetic elements of my work. So often when patients come to see me with their tumour, yes, they're concerned that it's cancer, but for most of them, they have basal cell or squamous cell carcinomas, and it's not going to metastasize anywhere. It's not going to be dangerous for their general health or reduce their life expectancy in any way. Their main concern is, am I going to be disfigured following this surgery? Am I going to be able to continue the sort of work that I do? Are my relationships going to be affected? Am I going to feel confident when I go out? Am I going to look asymmetrical? And these things are incredibly important, and they're often spoken about in a derogatory way. Oh, this is just vanity. It's absolutely not. It's really important. We're social animals. This is a really cosmetically sensitive area of the face, and so it's really important that I give my patients the best possible outcomes that I can, and obviously functionally around the eye area also really important. So it's quite pertinent that this was actually how I discovered Callus and Professional Serum. I had a patient who was an aesthetic nurse, and she came to me with a tumour on her left medial canthus, so the area between the bridge of the nose and the medial corner of the eye. It was a basal cell carcinoma, and in her practice, she was very concerned that she was going to be left with unsightly scarring. With tumours in that area, I tend to reconstruct them using a flap from over the nose. So I'm rotating the skin from the dorsum of the nose into the medial canthal area. And these heal really nicely because the contours are optimal. I'm not putting on a graft, so it tends to blend in really nicely. The only downside of it is that skin over the nose tends to be quite sebaceous. And in mobilizing the tissue, some of the sebaceous secretions can be released into the tissues, which can provoke an inflammatory response. I'm going to talk a little bit about inflammation and wound healing shortly, but the problem then when you've got quite an angry and inflamed response is that the tissues become thick, the scarring is apparent, and in such a cosmetically sensitive area, that's really not the result that you want. So she had an initially very uneventful healing post-operative period. But then after a few weeks, things started to get quite inflamed, which is the danger period I find with these types of reconstructions. And excuse me, she came back with quite an angry, hypertrophic looking wound, very erythematous, and she was quite distressed by it. So historically, my protocol for dealing with this kind of complication would be to prescribe fludroxycortide tape, which is an adhesive dressing which is impregnated with a steroid that sits on the wound overnight and it's removed in the morning. The steroids permeate into the tissues and that reduces the inflammatory response. But there are issues around the eye. They can promote a rise in intraocular pressure. They can also accelerate cataract, although I wouldn't expect that in 28 days of use. My other go-to measure would be 3 months of oral tetracycline, so doxycycline or limacycline. That's also quite a big undertaking, and it can create problems with dyspepsia, and patients have to make sure that they are protecting their skin from the photosensitivity that causes and potentially increased risk of sunburn. So not ideal, but I prescribed these for her, and then when she came back, in the meantime, she had independently found out about calcium serum, managed to procure some, and had started using it on her wound. And the difference was really jaw-droppingly exciting. All of the things I would have hoped would have been achieved over a period of months with the measures that I'd put in place had actually been achieved more or less within a week. And the wound was settling down. It was much less visible, much less angry. And so at that point, I contacted Cell Research Corp directly to say, okay, tell me about this product. I want to know everything about it because I think this has got great potential within my practice and will really benefit my patients. So I'm just going to talk a little bit about normal wound healing, and then I'll talk about what happens when there's a problem with wound healing and how calcium works to promote the best possible outcomes from wound healing. So the first stage is hemostasis. That's usually achieved surgically. The next stage is the inflammatory response. So we get an influx of neutrophils into the wounded area, and then that local environment can tend to become quite hypoxic because of the increased metabolic activity. That hypoxia, to a certain extent, is good. That drives chemokines to attract monocytes from the blood into the tissues, which then become macrophages. It attracts lymphocytes, and it also causes recruiting of the bone marrow mesenchymal stem cells, as well as stimulating epidermal stem cells. And then they are starting to produce more chemokines, growth factors, and all of the things that are then going to lead on to the next stage of healing. Now, the problem with the inflammatory stage is that it has to be very appropriate and measured inflammation, because if we get an exaggerated inflammatory response, then we see the release of reactive oxygen species and matrix metalloproteinases, and they're detrimental to the healing response. And if we don't see enough, then we don't move on to the next stage, which is the proliferative stage, where we start to see new tissue being brought in, new cells developing. So let's assume that we've passed through the appropriate amount of inflammation and we've moved on to the proliferative stage of the wound healing process. We get cell differentiation, proliferation and migration, we get new blood vessels forming, and we get re-epithelialization of the wound. Then the final stage, which can take months or years, is the tissue remodeling stage, where the collagen is being synthesized and realigned. And this is never more important actually than in the cornea. So what happens when we get older? Our healing response becomes impaired, and this is where we start to find that wounds don't heal well or don't heal at all. There can be other factors involved, for example, radiotherapy or diabetes, smoking, obesity, all sorts of other things that can exaggerate this. But let's just look at a healthy but older individual. We have altered production of chemokines, so those chemicals that are attracting important cells into the local vicinity are not doing their job properly, they're not being produced properly. We get delayed T cell lymphocyte, macrophage and lymphocyte infiltration, a reduced function of the macrophages, which would normally be phagocytosing the dead tissue and removing it. We get an increase in inflammation, and I've talked about the importance of not having too much inflammation and what happens with too much inflammation in the wound. It becomes counterproductive. We get a reduction in our growth factor secretion, and the epithelialization of the wound, collagen synthesis and angiogenesis are all delayed. And ultimately, the final phase, the collagen turnover and remodeling, is also adversely affected. The strength of the wound ultimately is compromised. So all of those things will tend to happen to a greater or lesser degree in aging tissues, and more so if you've got additional risk factors. So I'm going to go back to corneal surgery, to my roots in ophthalmology. When I discovered that Calasim professional serum was derived from cord lining, umbilical cord lining, it made perfect sense, because for decades in ophthalmology we've been using amniotic membrane, albeit human antibiotic amniotic membrane, as opposed to red deer amniotic membrane, but we've used it in high-risk corneal surgery and where there's significant ocular surface disease. And so for a high-risk corneal graft, for example, somebody with Stevens-Johnson syndrome, chemical burns, where you've got a really compromised ocular surface in general, these are very high risk grafts. They are at high risk of infection because they don't have a good blood supply. They are at high risk of rejection, because the inflammation that's ongoing in that area tends to lose the immune privilege that a corneal graft would normally have, because there are a lot more blood vessels in that area because of inflammation, but not necessarily nourishing the tissue that you want. You want to discourage fibrosis and scarring, because a scar in the cornea is going to make it opaque. But it also has a very significant effect on the level of comfort following the corneal graft as well. So for all of these reasons, we've been using it and continue to use it in ocular surface reconstruction in ophthalmology. So by taking the essence of what the stem cells are producing, because there are no actual stem cells in Calasim serum, but taking all of those cytokines, the hyaluronic acid, the fibronectin, all of the really nourishing elements of what this amniotic membrane or cord lining cells are producing, we can derive the benefits without necessarily having to use tissue. So really, this is just a slide to say these are the key secretory factors that are helping in our healing process: the cytokines, the chemokines, the growth factors, and the extracellular matrix proteins. And the main ingredients that make up Callus Professional Serum. And again, no actual stem cells in the product. These are stem cell derived tissue factors. Some of the in vitro studies, which many of you may be familiar with, in the top two images, this is the cord lining conditioned media compared with control on the effect of epithelial wound closure after a pipette tip scratch wound in the lab. So we find that there is more proliferative activity and faster migration and closure of the wound. So in this instance, skin restoration was completed within 40 hours. And you can see that hasn't happened in the control group. We also see that elastin tends to be expressed more in fibroblasts when they're exposed to calcium, and elastin being very important in terms of the skin health and the structure of the dermis. We find that fibroblasts exposed to calcium will also express more hyaluronic acid, which is important aesthetically and in terms of healthy skin structure. And we get a very significant increase in epidermal and dermal thickness. So skin is essentially behaving like much younger skin. So we see thinning normally of the epidermis and dermis with age. We're seeing with exposure to calcium that both the epidermis and dermis are thickening up and becoming much more robust and healthy. So I'm going to talk a little bit about how I use it in my practice. So in terms of the non-surgical use that I found very helpful with calcium is something that I call my calcium plasma facial, and I use this in my clinic. This is it's a sort of cosmeceutical facial, so it's particularly good for patients who either want to have a procedure that will more or less within a day or two improve their skin appearance and give them a rejuvenative result without any downtime and without any injectables. And I deliver it with a plasma shower. And I know that plasma showers are used in some parts of the world a lot, in other parts of the world not so much. But for those of you not familiar with plasma, it's the fourth state of matter, and it's a gaseous state caused by ionizing molecules. So it will split O2 into O, for example. And when I'm administering a plasma shower, you can actually smell an ozone-y kind of smell. And that's because of the oxygen molecules being split into unstable atoms, and then they have a biological effect. So they kill bacteria. They do in themselves tighten skin because of the improvement and the more useful level of the balancing membrane potential of the skin. It stimulates the generation of collagen, but key in this particular therapy is that it increases skin permeability. So skin, as we know, is non-permeable, and it's meant to be because it keeps everything that's supposed to be outside, and it keeps our tissues inside safe. The plasma poration will transiently disable the cellular adhesion molecules, so it induces a state of porosity for a finite time. So along the y-axis here is the control group, and you can see that the line above it is what happens when you treat skin with plasma poration. The first hour in particular, the skin is extremely porous, and you can place product on the surface which will be absorbed, which would normally run off, and that's what we're utilizing here to deliver calcium, and usually a non-cross-linked hyaluronic acid as well. So this is a demonstration. It's a completely painless procedure, the plasma shower, and then we drop on the calcium, which is instantly absorbed, followed by some non-cross-linked hyaluronic acid. And that just takes literally a few minutes in the clinic. So this is the same patient that you just saw being treated, and this is the day of the treatment before she had it, and then the same time the following day. And I think you can already see that there's some improvement in her skin, softening of her nasolabial folds, a reduction of her jowl, and plumping and lifting of the skin. But then if we look at her again in 5 days, then I think you'll agree there's a really marked improvement in her skin texture, her facial contours, and even some effect on her pigmentation. So this really illustrates what calcium is capable of in a non-surgical setting. So how else would I use it? I think any kind of ablative procedure is beneficial, because if you ablate the surface of the skin, you're essentially, again, making the skin porous. And so the calcium can be applied directly, immediately following the procedure. It has a really soothing analgesic effect. And then you can give the rest of the bottle to the patient to take home. And I would normally advise that they use it 3 times a day. So although I don't personally offer laser ablative procedures, if I were to perform a plasma ablative procedure, such as a non-surgical blepharoplasty, I would use it. I would use it following chemical peel. In microneedling, you can use it on the skin as the microneedling is being delivered, and you can also use it afterwards. And I also now use it for active acne with a plasma device, with a plasma poration device. I wouldn't use it just topically as a home treatment on active acne patients, because you don't want proliferation, but for the anti-inflammatory effect following chemical peel, for example, or plasma poration, I think it works very, very nicely. So I also use it. I have to stress, this is very much an off-label use, but this is how I use it surgically, following my blepharoplasty, surgical blepharoplasties, following reconstructive surgery, or any other kind of eyelid or skin surgery that requires suture. I would drop a few drops into the wound before I close up. If it's an open wound, I'd put a few drops onto the surface before the dressing goes on, and I give it to the patients to apply 3 times daily until the bottle has been completely used up. In some patients, depending on the degree of surgery, I might give them a further bottle to use. So not only does that then improve their downtime, improve their outcomes, and I have to say, I haven't had a case of infection. I know this is fairly anecdotal, but I haven't had any cases of infection in patients that I've used the calcium serum on. So first of all, that reassures me that it's not increasing the risk because I'm putting an extraneous substance on there. But I also feel that there's a likelihood that the healthier healing response is protecting my patients from infection, because it's increasing the rate of healing of the surgical wound. I also would recommend it in inflammatory dermatological diseases where you've got disruption of the skin barrier, such as eczema and contact dermatitis, atopic dermatitis, again, for the calming effect that would have. So I'd be interested in dermatologist comments on that. The other, in terms of my aesthetic clinic practice and how my use of calcium serum then impacts on other aspects of my practice, I find that patients that have tried the calcium serum post-operatively they tend to be more interested in the other products in the range, because they usually feedback that they really feel that they've benefited from using the serum, and then I can introduce them to other products. And similarly, the plasma calcium facial that I showed you, that would, I tell my clients that really that's a kind of shortcut into getting the effects that you would get from the multi-action cream over a few days that would take several weeks, but they can maintain those results either by having repeated plasma facials, or by then switching and using multi-action cream plus or minus the restorative hydration cream on an ongoing basis. But it's a nice introduction to the brand, and it shows them that this is quite a high-end product. It's quite expensive, but it's not style over substance. It is actually doing something on a biological level that's improving the quality their skin and the health of their skin as well. So that's really everything that I have to say in terms of my presentation, but I'm very happy to take questions.
Amazing. Thank you so much, Dr. Sen. That was fantastic. We'll move on to the Q&A now. So if anyone does have any questions, please just type them in the Q&A box at the bottom of your screen, and we'll run through them now. We do have, oh, sorry.
No, I've just spotted the question.
Yeah.
Could it be used by a mesotherapy gun? I don't personally use mesotherapy gun, but I don't see why not. I mean, I think if it's being used in the superficial tissues, then I wouldn't inject it deep. But I think on a mesotherapy type treatment, then yes, absolutely. Which chemical peel did I pair with the solution? My preferred peel for the vast majority of my patients is the VI Derm peel, which is it's called a VI peel, and it's a prescription only range of peels. There are 4 different peels. Some are more indicated for aging, some for acne, some for hyperpigmentation, and there are 2 strengths of peel. It's self-neutralizing, and so I can apply the peel. I wouldn't then, obviously, because I'm not neutralizing it, I wouldn't put the calcium serum on at that time, but I would give the patient the calcium to take home, and then use from about day 2, because they have a regime to follow. But I would say that it's a safe option really with any peel. The deeper the peel, the better the penetration is going to be. And I think it's important not to leave it beyond 2 days to start using the calcium. And it's quite hydrating as well. So in the phase where patients are starting to peel, applying that actually is quite moisturizing, because sometimes the skin is quite sensitive and reactive to other things that are putting on it. So I try and keep it simple and use calcium serum and something as simple as coconut oil, just literally for hydration. And then I would recommend then the calcium skincare range beyond that. So the serum, I'll pass that over to you, Laura, because I know that you've got very specific
so for that one, how long does the serum last once opened? Obviously, if you're using with the treatment, you'll use it quite quickly. We'd say if you're using it at home, for example, we have quite a few patients that use it every day in the evening, just as a sort of daily base layer. We'd recommend using it within a month of opening it. But the beauty of the product is it has a pH indicator in it, hence the pink color. So if it does become contaminated or expires, it will turn yellow, orange, or cloudy. So you'll know instantly not to use it. So we say about a month. It probably will last a bit longer than that. But again, yeah, you'll notice instantly.
Yes, I think that generally, if you're using it following a procedure and they're using it 3 times a day, they would use it up quite safely within that time period if they're compliant. And as I said, the experience of the soothing effect that it has means that I find that actually compliance tends to be really good, and people are actually interested in continuing and buying more of the products from the range because it's brought their confidence in that product. There's a question about using microneedling and calcium on acne scars. I think it's a really good use of calcium with microneedling, actually, because for the same thing, the microneedling, you are inducing an injury. I mean, a lot of the things that we do in aesthetics, and I suppose this isn't entirely aesthetic, but we're inducing an injury to tissues, and we are utilizing the body's healing and rejuvenative responses to improve the outcome. And so microneedling by itself will incite what we hope is an appropriate amount of inflammation to allow all of the healing response with the collagen remodeling and the improvement in skin texture and the reduction in scarring and reduction in pigmentation as well, we would hope. So using the calcium will reduce an excessive amount of inflammation that may actually in itself create hyperpigmentation. I know that in certain parts of the world, I know that are represented today, hyperpigmentation is a very feared complication of any kind of invasive intervention. By using calcium and feeding the fibroblasts, we tend to find that the melanocytic response is calmed down. So you will not only improve the appearance of the skin and reduce the appearance of the scarring, improve the texture of the skin, but you'll reduce your risk of any post-inflammatory hyperpigmentation, which in itself is something that we all fear as practitioners. My experience of laser treatment, I have to be honest, I don't provide laser treatment. I'm not a dermatologist, so I've not entered the laser arena for rejuvenation, although we do use lasers a lot in ophthalmology. So I don't have any personal experience, but I do know that calcium have a number of dermatologists and a selection of slides demonstrating other people's experience following laser. I mean, I think the thing with laser resurfacing is that it's the most invasive thing that we can do for our patient's skin, and therefore it has the biggest positive impact in terms of what you can achieve. But you also experience massive downtime, and there is the risk of the pigmentary changes. So I would say that this would be an excellent indication for it, but I can't give you any of my own personal experience. It just, in terms of the biological activity and the risks of laser ablation, it would make sense to use calcium, I would say. Can calcium serum be injected into the skin? That's a good question. I would tend to say no. That's not to say that it couldn't be, and it couldn't be injected safely, but it's certainly not something that has been studied. It's not something that I would feel was appropriate for me to do as a treatment without having done that. I know we're essentially delivering calcium beneath the epidermis when we're doing our plasmaporation, possibly our microneedling, and certainly when I'm dropping it onto the surface of wounds. But I don't feel that I don't feel that I'd have the appropriate governance in place to start using it for that sort of treatment. But I would imagine that that's something that that will be researched on a sort of laboratory basis and then possibly rolled out. But right now, that's not somewhere that I would recommend or where I would be prepared to go myself. So does the serum penetrate skin that hasn't been treated with something like a peel or plasma? So essentially, really what you're asking is, if you were to use it as a part of your skincare regime, does it have an effect? Yes, I would say that it does. Whether it's necessarily the most cost-effective way to use calcium when there are other products that are, that the multi-action cream in particular is my go-to for skin, and that is obviously designed for use twice daily on the skin, and is the delivery of that is probably going to give you more bang for your buck, even though the serum has a higher concentration of the stem cell derived products within it. Would you agree with that, Laura?
Yes, yeah, absolutely. So the multi-action cream and the restorative hydration cream both have a transepidermal delivery system. So it will penetrate the skin without any sort of treatment, which is why we recommend that for daily use. The serum, you're right, we do get some effects with, but yeah, it is our most expensive product, and we do find that sort of in terms of effectiveness, it's much more suited with the treatment.
Yes, I think also when you're applying calcium products topically, and unless you're doing it via microneedling or plasmaporation, it's going to take several weeks to get an effect. So if you use your serum and let's say it lasts for 2 weeks, which is fairly realistic, you're not going to be seeing the result of it during that time that you're using it. And so that, I think, might lead to people thinking, well, this hasn't really done me any good and I finished the bottle now. I think it's if you're using the cream, it's going to last several months. You're going to start seeing the results after 2 weeks, but then you're still using it and you're associating the product with the improvement that you're subsequently seeing. So I think that's the way that I would choose to go, and that's what I recommend for my patients. There's a question: is it okay to use calcium after cross-link injections such as Regeran? I'm not familiar with that. The cross-link word, I don't know whether this has anything to do with it. But when I'm using calcium following plasma shower, I would also normally add a non-cross-linked hyaluronic acid. You can use cross-linked products, but they don't tend to penetrate quite so well. I have colleagues that use Profilo, for example. I've tried to use it. I'm not necessarily convinced even Profilo works as well as some of the more mesotherapy type preparations that we would normally deliver in that way. And certainly anything with a larger molecular weight isn't going to penetrate. So I would always go for a non-cross-linked hyaluronic acid. So I'm sorry I can't answer that question specifically about Regeran. Product for vitiligo patients. That's a good question. I suppose the issue with vitiligo is that it's an immunological disorder, and the issue there is that often people get vitiligo in areas where they've been traumatized, and to introduce calcium via, say, microneedling, you might be concerned that inducing that kind of trauma might make things worse. That might be somewhere where plasma might actually be an atraumatic way of introducing the product. But I'm not sure whether, I certainly wouldn't anticipate that it would make things any worse. Vitiligo is quite a complex disease, so I'm not sure that necessarily it would make it better. But in terms of would it be safe to use, I think the product definitely, it would be the delivery that you'd have to be a little bit careful about, so as not to create trauma that might then induce a new patch of depigmentation. Any benefit of calcium? We've covered that, haven't we? Whitening, brightening effect while using the serum. Again, I would say that you will get that. You'll get that effect when you use the other products, the multi-action cream. Obviously, there's a cream specifically for pigmentation. So if you're trying to target pigmentation, then there is a specific product in the calcium range designed for that. You do get an improvement in pigmentation with multi-action cream, and you saw, I think, from the slide that I showed you of my my plasmaporation patient, you do get a brightening effect. Now, obviously, that pigmentation hasn't just vanished, but it's the appearance of pigmentation that has improved, because the general health of the skin has been augmented by the use of the product. So yes, you certainly do get an improvement in the appearance of pigmentation. I think if you put somebody under a woods light, possibly after long-term use, maybe there might be some improvement there, but it's what our patients are looking for as an improvement in their appearance, and it certainly can achieve that. Yeah, the smell, yes. Yes, it's an interesting smell, isn't it? And I do warn people about that. But I think in a way it's actually quite a positive, because nobody would market a product that didn't work with that kind of smell. So this is not a style over substance product. this is a product that actually does biological things, and our bodies, the chemicals that we produce, also have associated smells. So that smell is a reflection of the fact that this is umbilical cord derived cells that are producing these incredible active substances. So yes, you know, it's not going to smell like a flowery cosmetic product, because it's not, and it doesn't need to be. So I try and turn that around into a selling point, that you know, this is why it smells like that, and don't be put off by it. It's the real deal.
Absolutely. And I think, just to add on to that, sorry,
Yeah.
Dr. Sen, but we get this question a lot. We also didn't want to add any kind of scent or fragrance or anything like that, in case there was, you know, is increasing the chance of a complication or a reaction. So yeah, I think you're absolutely right. Try and turn it into a selling point. We know it works, and we don't want to sort of tamper with the actual formulation. So yeah, just on that.
Yes, and then also I think as soon as you introduce things like perfumes, the risk of irritation, allergy, intolerance goes up. I mean, one of the problems, if you look at any kind of cosmetic product, or even something as simple as shampoos, there are so many ingredients, and we're seeing an increase in the number of people who are having reactions to things. And then you try and narrow it down to one thing, it's almost impossible. So this is it's just a really pure product, and it does all the things that it says it does, which is also unusual in this kind of industry. I'm being asked which plasma shower machine. I use a plasma BT. There is also a Plaison device which has a shower head and an ultrasound head. So you didn't see it on the video, but you can use the ultrasound head to allegedly, I don't know how well the science stands up with this, but to try and drive the product deeper is what proponents of ultrasound tend to say. So a lot of aesthetic clinics have ultrasounds there already. So you can use your plasma shower, and then you can use your ultrasound at the end to try and just keep delivering as much product until the skin's absolutely saturated. For those people new to plasma, it's really important that you don't then slather the patient with SPF, because you don't want anything on the skin that isn't intended to go deeper. So they don't get any SPF. We just tell them, you know, hat, try and keep out of the sun. Don't put anything at all on their skin. Don't even cleanse before they go to bed. Don't drink coffee if it's frothy, because you don't want a tattooed moustache. Be careful if you drink red wine. All of these things, because the plasma is so efficient at inducing porosity to the skin, that just anything that lands on it can be absorbed. So it's a really great technology. And I think that for those people who've got very, very delicate skin, and for those people who are just very averse to the idea of injectables, it opens up a whole new area of development of your practice and your clinic, because people will feel potentially much more comfortable with that. And if they've got an event, they're not worried about downtime, that the results actually come online extremely quickly. Yeah, any other questions?
Amazing. There's one more in the Q&A box I can see, which is for microneedling. Do you use the serum with microneedling or after microneedling?
Both. If you put it on as you're delivering the microneedling, then some of that's going to go in. Also, it's got a lovely texture. It's just viscous enough that you get a sort of smooth passage of your microneedling device if you're using a pen type device, but it's not so thick that the viscosity causes drag. So it's really nice, and as I say, I think it's helpful for comfort. Obviously, you have your anaesthetic cream on, but you don't get that same discomfort as the anaesthetic cream is starting to wear off. But then you want to take advantage of the fact that the skin will remain relatively more porous afterwards, and use it 3 times a day afterwards. So you can use that same bottle during the treatment and then give it to the patient afterwards to take home with them.
Amazing. And I think that is all of the questions. So thank you so much again, Dr. Sen, for your time, and thank you to everyone for coming online. If you do have any further questions, please feel free to contact your local Callison representative or email us at customerservice@callison.com, and we'll get back to you. And hope you all have a great rest of your day.
Thank you, Laura. Thank you,
Thanks so
everyone, for
much.
attending.
Bye.